All right. So, first of all, we just want to say thank you so much to all of you that are joining us this evening, those of you that are joining here on Zoom, and those of you that are joining us live on Facebook. My name is Shanequa Moore. I am your host this evening, and this program, the COVID-19 Community Talk, is brought to you by More for District 12, which is my campaign. And I'll talk to you for a few moments about myself as well as why we're here this evening. Again, I'm Shanequa Moore. I am a licensed social worker. I am a mother and a community advocate. And for those of you that also know, I'm a candidate running for New York City Council and a special elections in District 12. And tonight, I am really excited just to have this conversation about COVID-19 and how do we stay safe as people? How do we protect ourselves? How do we protect our loved ones, our friends, and our family members? We'll be having some amazing discussions this evening. For those of you that are joining us via Zoom, there is a Q&A part of this panel, and we will be asking you to submit your questions through Q&A. For any of you that are not English, English is not your first language, and you may need to submit your questions in another language or in Spanish, please feel free to do that. Whatever is the language you're comfortable with. We do ask you to submit your questions that way. The chat box is also open. Please only put positive things in to our lovely panelists this evening. And again, your questions should go in the Q&A part. In the chat box, you can feel free to put in some things that you may want to say during the course of this panel and the chat box. For those of you that are on Facebook joining us live, I do ask you to use the comment section of Facebook. Go ahead and also share this video if you're joining from Facebook Live so that we can get this word and this great information out to as many people in our community as possible. All right, so who's ready to get started? I am. All right, so tonight we're joined by some amazing experts this evening. We have 3 medical professionals and 2 mental health professionals. The first part of this evening we'll be talking about medical safety as it relates to COVID-19. The second part will be going into mental health and well-being, and how do we support our mental health during this time. I want to start out with some statistics on COVID and just speak a little to how we, just to what we have gone through in New York State, and how cases have been rising and the number of deaths that we've encountered thus far. So we've been, according to the COVID-19 tracker health.ny.gov, statewide, there's been 22 million people tested. From those, today, there were actually 159,844 tests done. There were 784,000 people that tested positive in New York State. New positives as of today were 9,000 cases. The breakdown of this is 49.8% are female and 49.1% are male. So we can see that COVID is really no respecter of gender or person, right? We also know that in the Bronx, the cases are very high, and that's where I'm from. There's 71,738 people that tested positive in the Bronx, and that's a huge, huge number. So those of you that are in the Bronx, we have a lot of work to do in terms of staying safe. Statewide, we've had 35,288 deaths so far. So again, COVID is not left, it's still here. And this is why this conversation and this discussion is so vital and so important, so that we can talk about ways that we can stay safe during this time. So without further ado, I will be introducing our medical experts that's on the line today, three amazing, phenomenal women. And they will be talking to us more about how do we stay safe medically or physically during this time. Again, if you are joining us via Zoom, please use that Q&A box to ask your questions so we can try to get those answered for you. All right. So first up, we have Steffi. She is a registered nurse at Montefiore Hospital. She also sits on the board of my nonprofit, I Raise Girls and Boys International Corporation. She's a mother of two beautiful kids, also a wife. She's also a Bronx resident. She enjoys mentoring kids and just giving back to the community. And she will be joining us. She's joining us this evening. She is on her way to work, so she does have to leave us a little early. So we're gonna, try to get her on for as long as possible. So Steffi, I'd like for you to unmute yourself. If you can share your face, that'd be great. And just give us, tell us a little bit about yourself in about 2 to 3 minutes.
Hi, everyone. I'm so sorry about the camera difficulties. I'm using my daughter's computer, so I don't know if that has anything to do with it. But my name is Stephanie. Thank you so much, Shanequa, for the introduction. I'm a nurse at Montefiore, and I've been working as a nurse for 8 years now. And I am glad to be here. And this is honestly some unprecedented times, and things are definitely different. But I think as a community, we can get through it. Thank you.
Thank you so much, Steffi. Next, we have Annabelle Duo. Please correct me if I said your name wrong. She's newly wed, so I do have to remember her new last name. And she is a medical professional at Lincoln Hospital. Did I get that correct?
Currently, it was in Jacoby.
Jacoby Hospital. I'm sorry, she did transfer. She was at Lincoln Hospital, not Jacoby Hospital, also in the Bronx. She's also a mother, and she enjoys giving back in many ways to the community, and just a really amazing woman. So I'd love for you to take 2 minutes and introduce yourself to everyone tonight.
So my name is Annabelle Zua. I'm a medical clerk at, I was a medical clerk in Lincoln Hospital, and then I'm currently with a financial clerk in Jacoby. I'm a mother of a 2-month-old. I was pregnant during COVID, I was pregnant, and I also have taken the test 5 times and I tested negative. Well, 5 times while being hospitalized as well.
That's awesome that you tested negative. You have to definitely share with us some of the tips that you have been following during this time. And lastly, but certainly not least, we have Heidi on the line, who is joining us. She is a nurse practitioner from Stony Brook Medical, and she is joining us this evening. And I'd love for her to share with us a little bit about herself in about 2 minutes.
So Dr. Heidi Marius, work at Stony Brook Medicine Neurology Department and Sleep Medicine specifically. I've been a nurse since 2011 and just got my nurse practitioner, my doctorate in nursing practice in 2018. So definitely happy to be here to provide whatever assistance I can, especially in these unprecedented times.
So much, Dr. Heidi. So let's jump into our questions this evening for our medical experts. So the first question is general, and that is, what can families do today to stay safe and to protect themselves from getting COVID? And I know that's a very general question, but I know a lot of our families are feeling afraid. We know that there's been a lot of talks about a second wave of COVID happening. And families are just, people are just really scared, especially our seniors and those that have underlying medical conditions and just really need to be reassured or just need that information. What are some tips that you can provide to all of us on how do we stay safe during COVID, and how do we keep ourselves as much as possible. And I know that no promises, but at least whatever you can provide to us on how do we protect ourselves and stay safe. Starting with Dr. Heidi, and then with Steffi, and then with Annabelle.
Yeah, so pretty much it's been what everyone has been recommending this whole time. Basic hand hygiene, wearing the masks appropriately. Back to the hygiene, you want soap and water for at least 20 seconds. I know they usually typically say the birthday song for all the families out there when you want to talk to your children. Sing the birthday song to themselves. Make sure that they're scrubbing really well, making sure that they're using that soap. To even get even more nitpicky, not even turning off the faucet just yet, getting the paper towel and then using to turn that off the faucet, and then using that same paper towel to open up the door when you exit, going to that degree. In addition to that, with wearing masks, wearing it appropriately over your face, over your nose, over your mouth. Don't have it hanging off of your ear. Don't have it below your nostrils. That does not filter the air that you're breathing in, and it doesn't filter the air that you're exhaling out. So it's very important that you're wearing the mask appropriately, all according to guidelines. This is the information that most likely all of us are going to talk about is really what the CDC has been recommending this whole time. In addition to that is the social distancing. If you're not able to, continue to wear masks, but please, if you can, at least, and it's not at most 6 feet, it's at least 6 feet apart, making sure you're maintaining that distance, making sure that when it's very hard because they're the holidays and we're used to having our families with us, but keeping it with the nuclear family, that's also very key. Everyone is tired. We talk about the COVID fatigue and how I'm tired of wearing masks and I'm tired of social distancing, and it's so hard, but please be mindful that one life is so much more valuable and important than the time that we're spending social distancing. A lot of families, and I can name a few, I know of a few who during the height of the pandemic, when things first have come, they had gotten together, they didn't think it was very serious, and a life has been lost. And that's one thing that we don't want to happen to anybody in this community. Yes, it's happening all over the country, but I think what anyone can do on their own to be safe is important. And if they can, if you're celebrating the holidays, keep it with your nuclear family.
Thank you so much, Dr. Heidi. That was a lot of great information that you just provided to us. And I want to now pass it over to Steffi.
Yeah, Dr. Heidi's hit on a lot of key points there. Something else, I think that we're doing a lot so far because, I work on an adult medicine floor, and we've seen like a significant reduction of patients with COVID, even in the flu in general. Usually by this time of the year, we have a lot of flu patients, and just wearing the mask, hand washing, it's really helped a lot. I haven't seen any anyone with the flu so far. So I think we just need to continue what we're doing. There's been a concern about, supply of the masks, the N95s, but, you're just using a regular, having a cloth or something. Some people make it out of a sock or something, and, make sure we wash it often. I think that, that's helped a lot.
Thank you so much, Steffi. Are there any particular masks that are recommended for families to wear? Any type of masks? I know I think there are masks that our medical professionals wear that are a little different from the public, but are there any specific type of masks that are recommended, if anyone can speak to that?
So, it looks like Annabelle has something to say.
So Annabelle, you have to unmute your microphone.
Well, I haven't used the N95 because that was in the hospital, but being pregnant and I was not allowed, my job would not allow me to work from the hospital, but when I had to go food shopping, just as an average person going every day, just the regular mask that they were wearing, the disposable mask, that helped a lot. Even the cloth mask, having a filter, that also helped a lot, because I know some people think that they have to get the N95, but that actually helped.
Thank you so much.
Yeah, so back to what Annabelle said, she's totally correct. you don't have to have an N95. You don't need the N95 respirator. It's really not even recommended for the general public in order for you to use that. That's really more so for in the actual hospital, or if you're in a room with a patient who has COVID. So that's not recommended for the general public use, more so medical use. If there is anything that I would say about the masks, if there is a mask that you can stay away from and not use, it's the ones that have the vents. So they have masks out there that has a little port, so when you exhale, the air comes out. That is not filtered air. We do not recommend you using that. Reason being, and I don't know if it's necessarily been publicized as well, is that the point of wearing a mask is one, you protect yourself and you protect other people. If you wear a mask that has that exhalation vent or that exhalation port that does not go through filtration, you are not protecting anybody in the event that you have the coronavirus. So the CDC recommends a face covering. Also, in addition to that, don't use the ones that have a vent. You're not protecting yourself or other people very well because the air you're expiring is not ventilated. It's not filtered.
Thank you so much for that, Dr. Heidi. Very important information for us to know, not to use the mask with the ventilation because it's not protecting anyone if you are, because of the air coming out. Another question in regards to children wearing face masks, is that recommended? A lot of times I'm on the street and I see a lot of kids. I see parents with a face mask with kids that are not wearing it. Can you speak a little more to the importance of children wearing face masks? And anyone can jump in.
So if the children can try to, then try. It's very hard. And Annabelle, you have children? Okay, Annabelle can speak to this a lot better than I can. Go ahead, Annabelle.
Well, I just gave birth a few months ago. I have a 2-month-old, so my 2-month-old will not wear a mask, of course. But if I go to the public or take you an elevator, I use a cloth, like a cloth over my baby, and I strapped her on my chest, and I strapped my baby in, and I put her over the cloth. The cloth is a little bit thin, but it's just like wearing a cloth mask, but that she feel comfortable. I get her to a state that she feel comfortable, that she's not crying. Sometimes I put her a pacifier, just soothe her, and I put that over her. So when I take the elevator, if someone's in the elevator, she's protected. If I'm going to the store, she's also protected. But I really try not to take my daughter out. Only in emergencies, if I really need to go shopping, that's when I take her out. But that's what I use. I use a large, thin cloth that at least the air could be filtered.
Thank you so much. And Steffi, I know you're also a mother of 2. Can you speak to that as well?
Yeah, I kind of go with what Annabelle's saying too. Also, I got this stroller cover from Amazon. It covers, it's like a net. It covers the whole, stroller. So when I'm going to, my daughter is a year old and she wouldn't wear a mask. You put it on her, she's pulling it, and so I have that over her, like if I'm going to the store or something. But it's really challenging, like when you have children that age, even the older ones, like 5, they put it on for a minute and then they pull it down. It's not, like Dr. Heidi said, it's not on their nose, it's not covering their nostrils, nothing. So we just do the best we can and make sure that they comply as much as we can, and also limit how much we bring them out. If we can't afford to not bring them out, then that's better.
Thank you so much for that, Steffi. The next question is very general, and it's what are the common symptoms? And I know this is something that we can look up ourselves, but what are some of the common symptoms of COVID? How does it show up? And I know that varies, right? But what have you seen in your profession, Dr. Heidi, Steffi, Annabelle, to be the common symptoms that show up in adults? And does that differ in children in terms of the symptoms of COVID? And starting with Dr. Heidi.
Well, one thing I definitely want to say is that, yes, there are common symptoms, but, please be mindful, everyone, that there is something called asymptomatic spread. So that's the reason why we are, the beginning of the conversation was, how do we minimize our risk of transmission? Washing hands, wearing masks, social distancing, trying not to be in close contact with a lot of people, because you can look totally fine. And I've spoken to people who have been tested, they did come out positive, and they were totally fine. Their family was totally fine. So, yes, there are common symptoms, but just because you don't have any symptoms does not mean you don't have the coronavirus. So now, back to the point of, okay, what are the common symptoms? It could be something that even looks like a cold, a sore throat, the flu, a fever. I know we're using the number 100, greater than 100 degrees Fahrenheit. So sore throat, cough, difficulty breathing, worsening fever. Sometimes there's skin lesions actually, and changes in those skin lesions. You've got the loss of taste, loss of smell. I'm not going to go through all of them because I want to share the wealth, but I'll start off with those ones.
Thank you so much for that, Dr. Heidi, and definitely for highlighting the asymptomatic, those people that may not be exhibiting or showing symptoms, but they may definitely be positive. And that's really important to highlight and to remind people. Steffi, you have the mic next.
Yeah, most common that I saw was, shortness of breath, a lot of coughing. There's definitely other symptoms, but that was the main one. And then, from the shortness of breath, now people start getting, we put give them oxygen, wear masks on them, and then unfortunately some people get intubated. So those are the common, symptoms that I was aware of.
Thank you. And Annabelle?
On the height of the COVID, when I was working in the hospital, it was usually they couldn't breathe, or they had a fever. I had actually a family member abroad that had it. They lost the taste of sense of taste. So these are things, but they pulled through. Thank God.
Absolutely. Thank you for sharing that. So now I want to speak a little bit about the vaccine. I know that we have been hearing about the vaccine coming out, and now that it's sort of here in New York City, and I'm not exactly sure how it's going to be distributed or what the latest information is about this COVID-19 vaccine. But whatever information, Dr. Heidi, Steffi, and Annabelle, that you can speak to and provide to our community about it. I also know that a lot of people are afraid, and we talked about this prior to starting our talk, is that a lot of people are afraid to take the vaccine. A lot of people are afraid that it's going to have a negative effect on them. Some people are afraid they're going to die if they take it. There are a lot of different rumors going on, and I just want the experts to speak to this, to speak about this a little more. Dr. Heidi, whatever information you can give to the community and to the public about the vaccine, is it safe to take? What information can you provide to us?
Yeah, so right now there are currently two vaccines that are out there. The one that I'm most familiar with is 95% effective, and that's actually 7 days after the second dose. So right now the vaccine, from what I'm reading, is that it's a 2-dose vaccine. You take the first one. Yes, there is some protection, but the 95% protection is actually after the second dose. And I believe the second dose, from what I read, is that you'll get it 21 days later. That's when you'll have the most protection, the 95% that they're reporting in taking the vaccination. The question is it safe? From what they've found so far, yes, it is safe. It's totally understandable when it comes to concerns like this vaccine has been made a lot faster than a lot of the other vaccines. Am I going to die? Yes, valid concerns, definitely. But when you actually take a look at the science, from what they have reported, is that it's effective, it's safe. If you are able to get the vaccine, you should definitely take the vaccine. Now, are there symptoms associated? Like, let's say, for example, you took your flu vaccine and you got it in your arm, you got a little mild fever, you got a little achy in your body, and your arm was sore. I have read from actually a nurse who had taken the vaccination during one of the trials that she had similar symptoms. Something that was different in her case was that she had a very, very high fever. She was very, very sick. It only lasted for 24 hours, and she was fine after that. So it's important to know that some people, they might have minimal symptoms, and some people, they might have a really bad fever. They might feel really tired. They might feel really achy, but that after 24 hours, that had disappeared. So yes, very, very valid. Yes, concerns. However, that's also important to understand is we need to do what we can to protect ourselves. Another question is for the for who it's approved for. Right now, from what I've seen from the CDC, it's 16 and above. That's not to say if you're younger, you can't take it. It's just right now what the CDC is recommending. The next question is for people who are breastfeeding and also people who are pregnant. According to the ACOG, the American College for Obstetrics and Gynecology, they are recommending that it should not be withheld from people who are pregnant and people who are lactating. However, I will caution and say this, everybody needs to have a conversation with their healthcare practitioner. Nobody who is listening to this should in their minds make the decisions by themselves whether they should and should not get it without having a conversation with their healthcare provider first. There are many people who are most likely listening to this live who have other types of health conditions, who have other types of reactions, and you need to have a conversation with your healthcare provider first before you make that decision. So, all valid concerns, very much so. However, don't make the decision without being educated and having a conversation with your healthcare provider.
So much, Dr. Heidi, for that very insightful information. I definitely learned a lot, and you answered the second part, which were the risk associated with taking the vaccination. I'm going to go into Steffi now. Any information you could provide to us on this vaccine and anything that you can tell the community on whether this is safe or what are risks associated with this, anything that you can also add to that.
Yeah, I don't know much about the vaccine or, some of the side effects that are associated with it. I know in the few coming weeks when it gets to us, when we start administering it, then we'll see more or, people coming in with any adverse reactions. But like Dr. Heidi said, please talk to your providers, your doctor, your nurse practitioners, whatever concerns you have, write them down, make sure you have them address them. And, don't listen to, my mom will say, oh, no, I'm not taking the vaccine. I've gotten all these videos, from people saying, the vaccine is this or that. Definitely talk to people who understand and know the science behind it, and then make an informed decision from there.
Absolutely. Thank you so much for that. And yeah, I've been hearing a lot of different people, just a lot of things that people are saying about the fact that they're afraid to take it again because they feel like something bad is going to happen. And so we want to just bring real information and factual information to people to sort of decode those stigmas. We do have 2 questions coming in, but I do want to allow Annabelle to weigh in and to provide any advice on the vaccine as well.
I would suggest to talk to your doctor, especially if you have underlying symptoms. I'm not a doctor or a nurse, so as just like a clerk or just the average person, I will ask my doctor the recommendation. Like for instance, I breastfeed my daughter, and I will have to ask my doctor because I don't want to have, because I have also food allergies and things like that. So especially if you have allergies, you should speak to your doctor.
Thank you so much for that, Annabelle. So we have 2 questions that have come in so far. I'm going to start with the first question. Again, those of you that are joining via Zoom, please do use that Q&A part of Zoom so that we can get your questions in. So the first question is coming from Christy, and that is, if you have had COVID, can you catch it again? Can you get COVID again if you've already gotten it? And again, starting with Dr. Heidi, Steffi, and then Annabelle, if you had COVID, or just, I guess, Dr. Heidi, if you can answer that, would probably be best. If you had COVID, can you catch it again?
So yeah, actually, it's funny that you say that. Kind of in the height of the pandemic, one of the first confirmed cases that had it again, I believe, was in Hong Kong. And there's been a couple of other cases in other countries. The question is, yes, you can, but is it worse? Is it the same? Is it better? It's been mixed. One person had it and they caught it again, and their symptoms were more mild. Another couple of people had ended up getting it again. And what happened was that they had a worse response as a result of it. So that's why it's important. We don't know whom you might be. You might be a person who might not be as affected or might be affected worse. The point is, you don't want to play with that game. You don't want to play with that fire. Continue to protect yourself. If there's anything that we can impress upon anybody today or tonight, is continue to protect yourself.
So much. All right, so I will go into our next question. I see there are more questions coming in. And the second question is, what happens, is coming from Roger, and he's asking, what happens to those that don't have access to a primary care provider because they don't have health insurance, or only have access to medical or public health insurance? They're asking, how would I get in touch with a primary care provider? So it seems like there's about two questions going on. The first part is, if they don't have access to a primary care provider, what do they do? And then secondly, how would they get in touch with a primary care provider? Steffi, can I give that question to you?
Well, I don't know much about how to get in touch with the provider, but I know that we're mandated to treat anyone regardless of, if they are insured or not insured. So usually they come into the emergency room and then come to our floors, but I don't know much about, seeking help other than that.
Okay, thank you, Steffi. Annabelle, looks like you're raising your hand. We're gonna give you.
I could help you with that. If you are insured, if you have insurance, I encourage you to call your insurance company and ask if they could assign you a health provider, a PCP in your area close by to you. And if you're not insured and you live in New York City, you could go to your city hospital like Lincoln, Jacoby, Metropolitan, the city hospital of Coley Island, Elmhurst. They will see you even if you don't have insurance. You will they will give you a scale. If you are not currently working, you will have to speak with a financial counselor. They will assign you a financial counselor. You just have to bring your ID. Sometimes they will ask you for proof of address or proof of if you're working or not. But they will sit with you. They will scale you. If you have to pay $5, $20, they'll give you what you could afford. They will help you for you could see a provider. And if you need medication, also in the building, they have pharmacies that they will help you. You just have to just go in and ask to get an appointment, or even call 311 and get the hospital appointment line, and they'll give you an appointment, and you will sit before you see the doctor with a financial counselor, but you could see you, but they will not reject you for not. They will not reject you. You could see a medical provider even if you don't have insurance.
Okay, so if you said if you don't have insurance, you can still come in to see a doctor. Okay.
Yes, you do not have. If you don't have insurance, they will help you see a doctor.
Thank you so much. And Dr. Heidi, any information you can provide for us?
Yes, so federally qualified healthcare centers are also an avenue for those not going into the emergency or going to the hospital to access care. Federally qualified healthcare centers are definitely something that people who may have public health insurance or no insurance, they could use that as the entrance into obtaining primary care and also specialty services if necessary. I believe that there are also nurses, social work that are also available. So I don't know if Shanequa, if you can put federally qualified healthcare center, if they can kind of search for that term. to help them find out what's available to them in New York State, that would also be very helpful for them.
So I'm putting that in a chat box right now, the federally qualified healthcare centers, and I'm assuming that they're probably hospitals or clinics that are contracting to provide this service to those that are not insured or that have that public insurance. All right, so I'm going to go into our next question, and that is coming from Priscilla, and that is, would face shields be better for children? The question is, would face shields be better for children? I guess versus face masks.
So this is the challenge. So there's recommendations in terms of ages and face mask use. The CDC recommends that if your child is 2 years of age or older, they should wear a mask. The World Health Organization recommends that children 5 years and under should not be required to wear masks. I think and I understand the question of if they can try anything, maybe a face mask. I would say, why not? I'm sure it can help if the child can, but other people would argue, well, the virus, depending upon the airflow, can just go around the front and into the mask itself. If your child is able to wear a mask and they fit the guidelines from the CDC, try to have them wear a mask because it's filtered, it's closer to the face. The face shield itself does not filter air. It may block, but in the event that there's airflow around it getting into their face, then it defeats the purpose of the face shield. But I think we're all trying our best with our children and being the best parents that we can be in this time. And, it's just a matter of having the conversation with your children, following the guidelines. Annabelle, I know she had something to say. No? Okay, because I thought you did. I'm so sorry.
No, because I have a 2-month-old. So with children over 5 years old, I won't be able to give a good advice. Like I said, 2-month-old, I put a nice thin cloth over my daughter and try to pacify her and try to soothe her and put a pacifier before I could cover her face, even to go in the elevator or go food shopping or going to the bank or anywhere.
Thank you so much for both of those answers, especially coming from the parent side of it. I'm sure a lot of parents, especially of younger kids and babies, may have these questions. So I don't have any, I don't see any other questions in, but I'll give it about a minute. And as they're coming in, I would like for each of you, Steffi, Dr. Heidi, and Annabelle, to give any closing last words on staying safe or any other tips or information that you can provide to our community right now. That would be great, starting with Steffi, going to Dr. Heidi, and then to Annabelle.
Yeah, like we've just said, wash your hands, limit how you touch your face, your nose, before you eat, when you go outside and come in, wear your mask when you go outside, and just continue what we've been doing so far. And I feel like we can get through this.
Thank you so much, Steffi. Dr. Heidi?
Yeah, so just pretty much agree with Steffi. Wash those hands, don't touch your face, don't touch your eyes, don't touch your mouth when you're outside. As soon as you get in the house, wash your hands, soap and water for at least 20 seconds. Wear those masks. Don't get tired. Don't try and slip it under your nose. Maintain your social distancing from people. It's the little that you do now, and even though I say little, it seems a lot for people, but the little and a lot that we do right now could really save a life. It could save the life of your friend. It could save the life of your loved one. It could save the life of anyone. And that's ultimately what we need to do now, is try to preserve as much life as possible. There is going to be an eventual end. Thankfully, we have a vaccine. Make sure you reach out to your healthcare providers to talk about the vaccine. As long as you're able to get the vaccine and to be safe. Like, I tell people, the joke I have with other people is a rhyme. think with your heart and stay 6 feet apart. Really, it's yes, we think ourselves, but please be caring to other people, be mindful of other people, love each other to the point where you're like, I want to make sure you're safe, I'm safe, let's do this together. And once this is all over, yes, we can all hug, we can all do that, but let's get there first. We have to get there first.
That was really great and resonated with me, that think with your heart and stay 6 feet apart. And it reminded me of some new information that I heard at a webinar prior to this. It was by the Test and Trace Corps. And one of the individuals that presented actually said, if you are, if someone comes into your home and they're a visitor, even if they're a relative, you should still practice social distancing and wear your face mask. If they don't live in that house, that's something that should still be practiced. So, you know, that was new information for me, but, you know, again, reinforcing what Dr. Heidi was saying, think with your heart, stay 6 feet apart. And even, I know it's hard, especially when we have family members that we want to hug and that we want to be close to, we do miss that. And we'll talk more about that in our mental health part, but that was great. Thank you so much, Dr. Heidi. Annabelle, any tips that you can provide or advice, last words?
I agree with Steffi and Dr. Heidi. Sometimes you just got to think about the other person and be kind. Wearing a mask, if you don't have soap and water, a hand sanitizer, have it close by you in your bag or in your pockets if you're outside. I sanitize keys. I sanitize my phone. I also send it because my husband goes out a lot. He's the one that works the most. He's in and out the house. We put our shoes at the door. We spray with alcohol. I clean the light switches with just wipes, bleach wipes, clean your keys with clean your keys, or even the locks on the door, things that you touch all the time, like your refrigerator, consistently clean it because everybody's sharing it, opening in and out. Even the handles in your house, just on the bleach wipes, just wipe them down. Just simple things. And when you're out, just a lot of social distancing. Especially, I have a baby, so I try to social distancing just to keep her safe when I go food shopping.
Well, that's a huge one too, Annabelle, going food shopping and keeping that distance as well. Yeah, that was a lot of great information. So we are about to wrap up from our medical experts. We had Dr. Heidi, our nurse practitioner, Stephanie, our registered nurse, and Annabelle, our medical clerk, on the line that gave us a lot of great information on how do we stay safe, how do we protect ourselves. We talked about that vaccine that we are often afraid to take, especially in the Black and Brown community. And we've heard from the experts that you should talk to your primary care provider about the vaccine. And it is encouraged to take it, but definitely have that conversation first with your healthcare provider. Let them give you that that information, because everyone's medical condition is different and is not the same. So you definitely want to check in with your medical provider about that vaccine. And again, I love to conclude with what Dr. Heidi said, and that is think with your heart and stay 6 feet apart. I love that, Dr. Heidi. So I want to say thank you to all of you amazing ladies, Dr. Heidi, Stephanie, Annabelle. A round of applause for you taking time out of your busy schedules and being with us. Thank you so much. We're concluding the first part, but we are not leaving. We're just concluding the first part of our panel this evening. So I want to say thank you again, Stephanie, Dr. Heidi, and you have to go back to work. I think Dr. Heidi's at work right now. So thank you so much. Thank you for joining us. Have a great, great evening, and we will be in touch. Now we will be transitioning over to our second segment, and that is mental health. And before we go into that, we actually have someone that's a wellness coach on with us. Her name is Christy, and she is going to be taking us into a nice wellness activity. Christy has been a wellness coach. I met her during COVID, and she's super phenomenal. She has trained many professionals, not just in New York, but I also believe in other states. And when she speaks, you'll see what I mean. She has a very calming, just persona, and it's just super amazing. She has also done a lot of wellness sessions with some of the staff at my company, I Raise Girls and Boys, and she's such a jewel, and we're so blessed to have her on tonight. So without further ado, I am introducing and allowing Christy to lead us into a wellness activity. And Christy, anything you like to start out saying is absolutely fine.
Thank you. I just want to mention, I actually had COVID. So I did have it, and it was interesting that I was the only one that showed any symptoms, and I never had a fever. So it's important that we do what the professionals are telling us to do, and taking that into wellness and into what I do, which is mindfulness, and understanding that right now there's a lot of uncertainty, which goes into our fear, and people are fearful for themselves, their families, they're fearful